Good morning, everyone. So my name is Gianni Derrico, and I'm project coordinator of Regions for PerMed. Before we start, just a few words who we are and why we engaged in this project. So I come from Toscana Life Sciences, and Toscana Life Sciences is a non-for-profit organization which is owned by the Tuscany region, all the local authorities of Tuscany, the universities and the superior schools, and also banks and banks foundations. This is what we do. We actually, in Tuscany, let's say, we are the main facilitator when it comes health research, innovation, and policy. We have a business incubator. We manage the regional cluster and the national cluster in the life sciences. We carry out our own research, especially in infectious diseases. And of course, we also promote educational programs within university and also private sector. This is what we, let's say, our ecosystem. We have generated since our foundation 2,075 million euros. We have supported over 40 startups, spin-offs, and research groups. We hire over 450 highly qualified students. 60% of them have PhDs. And we have delivered over 600 scientific publications. We have services, research infrastructures, we have technology platform, and we have over 10,000 meters squared of equipped laboratories. And these are our area of expertise, which provide us the, let's say, the right background to carry out this kind of project like Regions for PerMed. So Regions for PerMed has actually been, let's say, we had some brainstorming back in 2017 when everyone was discussing about personalized medicine, mostly from technology point of view. And we saw, because Italy, taking into consideration how the healthcare systems are organized in Italy, that they are a very important key enabler. And we should have somehow we should have understood how the regions can contribute to the implementation of personalized medicine. So we kept brainstorming about this, and we realized that in Europe, the regional authorities are really important. They are responsible for 50% of public investment in Europe. They receive 25% of tax revenues, and they are the major public employer. So we understood that those are the regions are a key stakeholders to bring on the table if we want to actually bring personalized medicine in people's hands. So we designed our project, which was like a piece of a bigger European strategy on personalized medicine. And those are, let's say, the IC PerMed, and before there was PerMed, which initiated the whole, let's say, movement of implementation of personalized medicine. And then we have the ERA PerMed, and then we have the Regions for PerMed and SAPHIRE, which are the two sister projects here, and then other projects that are, let's say, focused on the international aspects, and we are part of these projects. And then we have also some strategic initiatives which have been carried out in the meantime by the European Commission. As Einar pointed out, this is the so-called IC PerDem family, and that's where we are. And we are very proud to be a part of this family. And there's always great occasion to learn new things. This is, I think, you have already seen these pictures. This is what the personalized medicine is within the regional policy documents, and especially the smart specialization strategy. This is the regions that have health as a research and innovation priority. And these are the regions that have personalized medicine within the smart specialization strategies. Although when we went reading these documents, and I know that you have also updated this map, there was personalized medicine was not intended at the same level, and there was huge discrepancies on how it was implemented. So we decided that it was very important to try to coordinate all these activities. And how we are doing this? So we have identified, okay, these are the overarching goals of Regions for PERMED. So we want to coordinate the European regional policies when it comes personalized medicine. We want to strengthen the industrial specialization areas in Europe and allow personalized medicine to flourish as an emerging industry. And we want to enable interregional joint investment on personalized medicine. But before we do that, we had to set some specific objectives, and the specific objective is, one of the specific objectives was to organize the technical dialogue between regions about 5 key strategic areas that we have identified with the support of our advisory board as very important to align, to coordinate regional authorities around. So these are the 5 pillars of Regions for PERMED. We started with the big data, electronic health records, and healthcare governance to understand the role that regions can have in investing in central digital infrastructures and how this can impact the overall governance of healthcare systems at the regional level. Then we had another pillar, which is health technologies and integrated care. Then we have the role of industry, the innovation models that can be applied within healthcare system, and then the last is social and health economics aspects. So we did carry out this policy dialogue, which was based on a scientific conference. So before we draft a rationale together with our advisory board, around this rationale, we organize a scientific workshop where we invite all the experts to discuss with us the barriers and analyze potential solution. Then we bring all these outcomes to a workshop with the regional authorities. We also try to scout for best practices in that area, and then we finalize with a key report, a key area report, which has policy recommendation, research and development recommendation for that specific area, and also some models and some contacts. So if regions wants to implement that specific best practice, they can also get in touch with people who are leading in Europe. So far we have, okay, these are like the 4 pillars of the policy dialogue of Regions for PERMED. We had a big kickoff conference back in 2018, November 2018, sorry, in Milan, where we had over 500 participants from over 330 countries. And it was carried out back to back with the EAPM Personalized Medicine Congress. Then we had we started the policy dialogue around the 5 key areas, and these are the numbers of big data. Then we had, and the report has been released in April 2020, health technology and connected and integrated care. The report has been published last month. And then we had health industry, that the report is going to be published in the next couple of weeks. And then we also had, it's not updated, but we also have the report of the 4th key thematic area, which is being released in May 2022. So these are the interregional committees, so people who are who follow our work, who interact with us. Those are mainly regional authorities and technological stakeholders. We also try to raise the awareness and raise the commitment of European regions through a series of actions like policy-related actions and institutional events. And we presented our project to the European Week of Regions and Cities. We have organized a meeting in Brussels with the European Commission and some members of the European Parliament and some stakeholders. And we also have tried to not lose the focus. So this is, when it comes to personalized medicine, we have be sure that all the papers are like discussed within with the scientific communities. So we have also submitted more than 5 scientific papers related to our project. And these are all the papers that can be also downloaded from the website. And these are the members of our advisory board, which I would like to thank for their support through all the project. And that's it. This is the research, the project team. Thanks.